Game-changing project has been initiated to pool the procurements of medicine in Africa. It's a genius initiative. It's essentially going to help cut the costs of medicine and boost the continent's access to good quality medicine and better healthcare systems. So who's all involved in this? Well, TK Global Experts, in collaboration with the Africa Resource Center and the UN Economic Commission for Africa, believe this is going to change millions and millions of lives and, of course, transform the continent's economic trajectory, especially from a health perspective. It's great to have on the show with us Kamogelo Mampane, CEO and founder of TK Global Experts. Kamogelo, good morning. Good to have you on the show. And there's a lot of solutions that has been put forward here, wonderful collaborations. I want to ask this, though. What problem are you actually trying to solve? Because it's a massive issue when it comes to medicine, affordable, good quality medicine in South Africa and Africa. What are you trying to achieve exactly?
You've said it quite well. The biggest issue is access to medicine. And that also means that we have to shape the market, which is ensuring that most medicine that has been consumed on the continent is actually been manufactured in the continent. So the current problem is that African countries, the entire medicine that they consume, only 2% is made locally on the continent. So 98% of it comes from different countries outside the continent. That's the biggest problem. So if you want to talk about economic growth and supporting job creation on the continent, obviously you have to deal with medicine. And we know, for example, that UN and also African Union have agreed that they want to increase the expenditure on health. I mean, currently, if you think about what other countries are spending on health, African continent are still spending only about $2 up to $89 per GDP on medicine. Whereas if you look at America and Europe, that expenditure is about $4,000 per capita. So we are nowhere near making an impact on medicine. And of course, availability. We still have problems, and especially here in South Africa, when clinics and hospitals are running out of medicine.
Logistics-wise, I mean, this must be monumental to try and get your head around. How do you begin to get the logistics of this around? Because that'll have an impact on the cost of the medicine. Yes, you can have production centers in Africa, wherever that might be.
Of course.
You can give some examples, but you still have to get that medicine from there out to the rest of Africa. And are those logistics supply chains in place?
We are quite fortunate that most manufacturers on the continent, because to produce and to supply medicine in any specific country, you have to be registered. There's a huge regulatory requirement that these manufacturers have to comply with. And the biggest problem is that if you have a capacity or you are registered in South Africa, you cannot sell the same medicine, for example, in Ethiopia or in Ghana or in the Comoros. So African countries are now starting to align their legislative requirements so that we enable transportation of this medicine, but also supply into other countries. Yes, of course, our ports still need a lot of work. I mean, you know the problems that we are facing logistically, but most medicine can be shipped. We have enough ocean on the continent that we are able to move.
A lot of access points.
Yeah, we have a lot of access points. And of course, through the Africa Continental Free Trade Area, those ports are now being opening up. And we see even some countries like Rwanda and Kenya opening up even just people to travel. And now we know that by December, you won't need a visa to go to Kenya.
That's right.
And we won't need a visa to go to Rwanda. Right? We're hoping that many countries on the continent will start to do the same, not just for people, but for the goods that are manufactured on the continent.
It's almost like Africa needs a medical visa-free zone. That's almost what you need. I want to talk about two things. One is, first of all, if you bring it all in-house, let's call it in-house, in Africa, on the African continent. If you're able to reduce the costs of not having to import medicine, produce it here and ship it out, etc., I imagine then that could free up more money to improve healthcare facilities as well. I imagine that is a good knock-on effect.
Absolutely. So let's make an example. We talk about the Africa Continental Free Trade Area. We talk about, 3.1 trillion of GDP. Now, medicine, if we bring it up to about 15% of the medicine of the budgets to health, it means that, and if we save, so even if we don't do a lot of work in terms of understanding the market and the supply and demand, doing the total cost of ownership for medicine, even if we just only pool the procurement for 10 countries, they will be able to save at least between 10 to 15%. That's almost 69 billion of savings that we can have on medicine. I mean, that is a bigger, 69 billion is bigger in terms of GDP, bigger than Burundi and many other countries, Cote d'Ivoire in terms of their GDP, just by pooling our resources.
It's bigger than some countries' GDPs. That's a lot of clinics and hospitals.
It is. So you can imagine the investments. I mean, we struggled just with COVID.
Right.
African countries were standing in a queue, right, to receive medicine on time, life-saving medicine. That's 69 billion. It's big enough to invest on the continent and to ensure that we won't have this challenge of waiting for somebody else to give us our medicine, and especially our essential medicine that we so require.
You don't want to be standing at the buffet queue, moving to the back the whole time because America and Europe are looking after themselves, first of all. It does take me to the other side of this coin, and I'm sure it's something you either have addressed or I'm sure it's something you will address. The medicinal market is incredibly competitive. There is a lot of money involved. Let's be honest, it's also a money-making business. What happens if you were to bring this all intercontinental, intracontinental? How does it affect relationships with overseas manufacturers for some ingredients, expertise, their licensing, their registrations of medicines? What happens with those relationships? Because they know they have a captive market here. It's the only way to describe it. Now you could potentially take that captive market away, do it in-house. What happens with Europe and America, et cetera, et cetera? What happens with those relationships?
Most medicine outside Europe and the United States is actually being manufactured in India and China. Outside that, you have Egypt, Morocco, and of course, South Africa. Manufacturers understand that there's a 3.1 trillion opportunity. So it's all about opportunities. And of course, we have to be mindful. For example, we've learned our lessons. Here in South Africa, when we said we are going to support a manufacturing house here for vaccine, we will go out on tender. We appoint a country or a company outside in India, whereas we've said we are going to invest here locally. So however, many manufacturers understand that. And also not just the manufacturers, the World Health Organization, you'll see they are also supporting this initiative of countries because they understand that the closer you come to the economies, right, that are going to consume this medicine, the better in terms of your logistics, the better in terms of your pricing. And because you are closer to individuals, it also helps you to create new medicine because you are able to see the impact of the medicine on the continent, but you also have data, which is very, very important in manufacturing and creating new technologies in medicine.
Just as we start saying goodbye, there's a lot of solutions, and you've highlighted many of them. The key question here is going to be when? What is the timeline on this? Where are you in the whole process?
So we have invited the ministers of health that will be coming to Ethiopia in January. There's also the 10 countries that are supporting the pilot. On the 5th of December, we'll all be going to Ethiopia to test these new modalities and also to test the framework that we have developed. So it is going ahead. We're hoping that by June, July next year, we will start with the first pilot on the continent.
And can you pick a country for us? Where would the first country be? Would it be us? Do you know? Where would you like it to be?
Of course, South Africa has to be part of that process.
Asking. But where would you like it to be?
We have 10 countries that are going to sign up in December. So if we talk again in December, after the 7th of December, we'll tell you that these are the 10 countries that have all agreed to participate at least on the 10 on the pilot.
You know that you're going to be back with us on the 7th of December, then we're going to have that exact discussion. I won't let you forget it.
I'll be in Ethiopia when I come back after the 7th.
It's called Zoom. It's fine. We'll find
you. All right, we'll do it. You'll find me.
Kamogelo, thank you very much. All the very best. Very, very clever. If this can be pulled off, and there's no reason why it can't, just imagine what it would do for healthcare in South Africa, in Africa as well. But also, you go one step further. Imagine the job creation. Imagine what it does for the continent's economy. And I would argue, probably the best part is a less reliance on medicine for Africa coming from countries that don't necessarily see us as a priority. Kamogelo Mampane, CEO and founder of TK Global Experts.